Thank you, Mrs. Ghani. It's a pleasure to serve under your chairmanship, and I want to also congratulate my honourable friend for securing this very important debate. And I also want to start by extending my gratitude to all those working with those with disabilities, particularly in the education system and the wider social care system during these incredibly difficult times. When it comes to learning, we know from our own family members the challenges that children are facing. And of course, those challenges are even greater for those children with special education needs and disabilities. And I've seen that in my own constituency, as other colleagues will have seen. The transition from face-to-face learning during the first lockdown to using technology has presented some particular challenges for those, particularly young people, who have learning disabilities. And of course, in the context of adults who need social care and support, they've faced huge challenges, as we've already seen. And local authorities have been at the front line in trying to protect them, along with other agencies. But they've been doing that in the context of a decade of austerity. And in my own borough, what we've seen is £200 million worth of funding reduced over a decade. And that kind of austerity in public service provision doesn't come without consequences. It has a knock-on effect. So, Mrs. Ghani, when we faced the pandemic, what we saw is local services on the edge, in any case. And in that context, they've had to support those who really need support. But the reality is that we've seen this virus really cause a bigger impact on those who are particularly vulnerable. And this group, as we've already heard, face huge vulnerabilities. According to the government figures released in October, almost a fifth of pupils with special education needs are currently absent from school. And to compound this, according to the National Education Union, only 6.5% of parents of children with SEND said their online home learning platforms were accessible. The evidence is pretty clear that the education system is not able to cope effectively to respond to the needs of young people with disabilities. And in terms of a recent report, in terms of differential impacts, we know it's very well documented that we've seen a higher prevalence of deaths among those from Black and Asian and minority ethnic groups. But also, according to Public Health England, people with learning disabilities were up to 6 times more likely to die from COVID-19 during the first wave of the pandemic. That is shocking, and it requires action by the government to make sure that we learn the lessons, just as we need to learn the lessons on the differential impact in terms of death rates among Black and Asian minority ethnic groups. And of course, these intersectional issues, interactions between those from minority groups who also have a disability needs to be understood too. So I hope when the Minister responds to this debate, she can explain to us what actions the government is taking to protect this vulnerable group, so that as we face more restrictions in the coming weeks, which we've already seen here in London and South East, we are now in Tier 3, that those groups who are vulnerable, particularly those with disabilities, are getting the support they need. As I said, Mrs. Ghani, since 2010, we've seen reductions in local government funding. And in this pandemic, despite the government's commitment to give the resources that local authorities need, the reality is, in boroughs like mine, the extra burden and costs of COVID has not been fully met, which is having a knock-on effect on services, including services to those who need adult social care, as well as young people who need additional support who have disabilities. And when we look at schools, a number of schools have already said to me that the additional cost of COVID to make sure that schools are COVID secure has been between £50,000 and £100,000, depending on which school we're looking at and the population size. So it's very important that the Department for Health works closely with education to make sure that the institutions that are at the front line to protecting those who are vulnerable and those with learning disabilities get the support they need, and we take action to prevent further loss of lives as well. In terms of the shortfall of funding, my local authority still has a shortage of 30 million just because of the cost of COVID. And so I hope when the Minister responds, she will be able to update us on what she is doing with other departments to make sure that local authorities and other providers, including education providers and those at the front line, care providers, are getting the support they need, particularly during the coming months, until we get a proper implementation plan for the vaccine, particularly for those who are most vulnerable, as many are in this group. In conclusion, Mrs. Ghani, I want to highlight some of the challenges facing my constituency. What we have got to have faced is 60% of young people, 60% of children who live in poverty. And we have, unfortunately, one of the highest rates of children with autism in the country, not to mention severe overcrowding. And that's why my constituency faced the fourth highest age standardised death rate in the country, despite being a relatively young population. And so when you look at these systemic challenges, and then you consider the plight of those with disabilities, the situation is very serious, which is why it's really important that the government looks very carefully at the evidence and the data and responds with resources and support based on need rather than other considerations. That is the way we're going to be able to protect those who are vulnerable in our communities. So my plea to the Minister is please take action to provide the support local authorities and other providers need urgently. And if she can, I would be grateful if she can provide an update on what steps her department is taking in particular to address this differential impact in terms of death rates for those who have learning disabilities, as the Public Health England report highlights. Thank you.